Chairperson of the Meghalaya Assembly Committee on Women Empowerment, Dr. Ampareen Lyngdoh, today informed that the Health Department has assured that all pregnant government health workers in the state will be allowed to work from home. She also appealed to private hospitals to extend this facility to their pregnant staff. The committee today held a meeting with officials from the Health Department, the Directorate of Health Services, NHM and NAGRIMS to discuss matters including death of a pregnant nurse at Ganesh Das Hospital, the MMR and IMR rate of the state's preparedness for a third wave, the rising numbers of health workers in NAGRIMS contracting the virus and more. Committee members Hima Shangpliang and Meryl Bonsaim were also present at the meet.
The other thing that we discussed here was also the MMR, IMR for the months of March, April, and May 2021. Numbers are alarming. There were 13 MMR deaths in March alone, 13 in April, and the department had said that they would get back to us with the MMRs of May 2021. And cases of these MMR deaths were indicated in East Khasi Hills 5, West Garo Hills 6, North Garo Hills 1, Southwest Khasi Hills 1, and indicating that areas where the pandemic is hitting very hard, likely that there is also this pressure for survival of women in childbirth procedures. So we had at length discussions with the Department of Health, and we were given the assurance that they would look into the matter and that they would address these issues. We also discussed with the Health Department the status of vaccination of health workers, and they said that it was at 85%. And that there is a high probability that this other 15% of non-access of vaccination or vaccination hesitancy, as they say, likely because health workers themselves were yet to be convinced. And there has been an assurance given to us that efforts have been put in by the government to even conduct important research, and the Principal Secretary Health had given us an assurance that there was an effort being put in by the government to go up to a one-to-one interaction with all those that refuse to be vaccinated. They did, however, also talk about the fact that out of the 300 plus deaths in East Khasi Hills alone, none of the victims who died due to COVID actually had their first dose, nor did they go for any vaccination, which means that, again, vaccination is one area which needs to be reinforced in the entire state of Meghalaya, because ultimately that would be the best protection for citizens in general. We were not able to talk about universal vaccination because Government of India has to address it. A huge population of children, a huge population of those under 45 are still not vaccinated. There is a huge pressure on the government for procurement of the vaccine itself. We were made to understand, however, that even that was taken care of, and that government now will shortly receive all of its consignments to administer vaccination to all age groups. We talked about the 50,000 ex gratia payment to people who died from COVID. There was a lack of communication there because we didn't quite understand. But we will have a subsequent Zoom meeting just to talk about this 50 lakh ex gratia payment to all those victims who succumbed to COVID-19. We still don't have details, and we've requested the Health Department to share information with us. We also talked about the death of the sister from from Ganesh Das, late sister Manisha Turnia. Government is putting in all effort to ensure that whatever is due to this great warrior who sacrificed her life, despite the fact that she was 6+ months pregnant, should be addressed. We've requested them to ensure that whatever needs to get done to compensate this family for this great loss should not be hesitated from the side of the government. They've given us assurance that they will do it. We are going to watch and see what are the actions they will take. We also talked about the fact that there was a government order that exempted all pregnant women and disabled individuals from going to work during the pandemic period. There was a gray area of lack of understanding of this notification, and we have been assured by the Principal Secretary Health that a notification will be issued to ensure that the 300+, which is a huge number, of pregnant health workers, which is inclusive of nurses, inclusive of doctors, they will be no longer sent to work, but they will be given assignments to work from home, where they will assist government in all of their interfacing programs, so that we protect these 300+ health workers who will become very vulnerable if they go to their workplace in person. We have been given this assurance that this will be quickly implemented in all of the health centers, the CHCs, the PHCs, the hospitals. Now we also appeal to private hospitals to ensure that all pregnant health workers, irrespective of their capacities, they could be lab technicians, they could be nurses, they could be doctors, should be allowed to work from home and given a different kind of a job without denying them their salaries. So with salary protection, this is something that we are appealing to all private institutions to also please protect pregnant women who cannot have the vaccination. Then we also had a brief interaction with Negrams Hospital, where the director and the entire team of Negrams was there, and we inquired on the, again, loss of another warrior, Nurse Badaphon Rapsang, with great sense of sadness. We also offer our condolences to the family of Nurse Badaphon Rapsang. And we have also requested the Negrams Hospital to ensure that all pregnant nurses and health workers, lab technicians, doctors should be allowed to be working from home in different aspects of healthcare, and salary protection for them as well. We have also discussed the question of high numbers of staff in the Negrams testing positive. And we have been reassured by the management of Negrams that they are working on it, and that they're going to ensure that they reach a stage where every worker in the institution of Negrams should be vaccinated, protected. We also requested Negrams to walk that extra mile and to ensure that maximum support should be given as a mark of appreciation for the sacrifice of Nurse Rapsang to the institution of Negrams. So this assurance we have been given, and we were able to connect the Negrams Hospital and the government of Meghalaya to also discuss the probable impending third wave that may attack a new host of vulnerable citizens, which is our children. We had a threadbare discussion as to how prepared is Meghalaya in the event of the third wave, which may attack children particularly. And situation is not good, but systems will now be alerted. There will be a focused attempt by the government to focus on these issues. We need pediatricians. Other doctors who are not pediatricians should be immediately sent for trainings. Nagrams is willing to train them, if I understood correctly. Government of Meghalaya has to immediately prepare beds with ventilators in all the districts, particularly in districts where we are being hit hard, like East Khasi Hills, West Garo Hills, East Jaintia Hills, and West Jaintia Hills. So these are the areas where we need to look at this probable impending third wave.